So we've been locked down for a week and distancing for longer. Where does this end? And what is our exit strategy?
So I think early on the question was, could we eradicate this? And I think it was really clear that it's not possible. It's now spread too far, and the way it transmits, it's here to stay.
At first, the government proposed herd immunity.
60%?
60% is the sort of figure you need to get herd immunity.
The concept seemed to be you let the virus spread in a contained way throughout the population, so enough people had immunity to stop it in its tracks. But then something seemed to change.
From this evening, I must give the British people a very simple instruction. You must stay at home.
The challenge is what happens when we actually open society again, because lockdown is not optimal. It is a very expensive way to address the virus, both socially and economically, and it is a last resort and quite a crude instrument. And so I guess what I would say is that it's a really positive message that what we're doing is working, but we need to be thinking towards the next step. How do we actually get kids back into school, get workplaces open again, actually move towards some kind of semi-normality? And I think that's only through moving from quarantining everybody to only quarantining those individuals who actually are virus carriers. And that's the only way to get that data is through testing.
Experts have told Newsnight that ending this global outbreak by lockdowns alone looks almost impossible. The spread is simply far too wide. Ultimately, we need a vaccine to protect us or effective drugs, which don't exist yet. So the question becomes, how do we manage up until that point? It's a case of balancing the harms of COVID against the harms of delaying treatments for other illnesses and economic damage. One solution might be to take a more local approach. Public Health England data show that some areas don't have the outbreak as badly as others, although without proper testing, we don't know the full extent of infection in different geographical areas.
Once you've actually got the epidemic under control, you then need to begin to really do intensive case finding and contact tracing at local level, so that actually, as you eliminate the disease in local areas, then you could have local controls put in place. And one of the big issues with this epidemic is it's been treated as it is a national epidemic, but it's very London-centric at the moment, the response. And what we have is multiple epidemics going on right across the country, all at different stages.
Professor Pollock says one reason going down the testing and contact tracing route, as outlined by the WHO, may be compromised by a lack of capacity in local authority public health services because they've been underfunded.
The government needs to get much better data to understand what the real prevalence of the virus is, how many people have been already infected in the community. It needs to start to do the contact tracing. It needs to rebuild local teams, regional teams, really rebuild that to do the contact tracing and get the testing underway to complement the tracing. The big problem is the structural issues since the Health and Social Care Act, which make it very difficult, and that combined with the decimation of public health, make it very difficult to get enough capacity. So what needs to happen is local public health teams need to be rebuilt using lots of volunteers.
Whatever happens, it's not going to happen overnight.
We probably won't go back. It's not like a switch, right? That, we have normal life and then we have lockdown. I think what we've seen in other countries like Singapore have been stages.
It's still not clear which exit strategy the government's pursuing, but none of them will be easy. However we get there, there are going to be some complex and challenging decisions ahead.
Deborah Cohen there with the UK situation, but we're going to take a wider look now because Sweden has gone its own way through this pandemic. The country is not in lockdown, the sight of couples strolling through cafes and squares almost jarring at a time when so much of Europe's staying home. Until last Friday, that country was even permitting gatherings of up to 500. That's now been narrowed down to 50. But the country has adopted the herd immunity strategy. The scientific community is pretty divided on whether that one is the right one. Gabriel Gatehouse is here to talk us through it. What are they doing?
Well, it's not that they haven't done anything. I mean, they have closed some schools, only for over 16s and universities, so that's not the majority of them. Public events you mentioned, at first, until this weekend, you could have a public event of up to 500 people. It's now only 50, but still, that's quite a public event. And as you said, restaurants, cinemas, theatres, they're all still open. Basically, they're asking people to exercise individual responsibility, but what it isn't is a lockdown. Sweden basically is where we were about 2 weeks ago. That is, they're not really talking about herd immunity, but it's effectively what they're practicing. They believe that draconian lockdowns don't, in the long run, save lives at the moment, as the science stands, and they think they're unsustainable. Now, if you look at the cases, just under 5,000 cases in Sweden, 239 deaths. Obviously, a much smaller number than in the UK, but also a smaller population. So in terms of cases, it's about equal to the UK per head of the population. But more and more scientists are getting concerned. About 2,000 Swedish doctors, scientists and professors signed a petition last week. They're calling on the government to do much more. And I spoke this evening to one of them, Cecilia Soderberg Naucler. She's a virologist at the Karolinska Institute in Stockholm.
We were both in the same boat and you jumped out of the boat and we are alone in the boat still now. I am very concerned at this point. We are alone in the world with this strategy, and I feel that our health authorities are not transparent into the data that they build their strategy on. And we are now left in a situation that we are not mitigating enough, and I fear that in a couple of weeks we will have major overload in our healthcare system.
This was not a policy led by politicians. This was very much down to Sweden's public health authorities. Yeah. You've spoken to the man who devised it, essentially.
Yeah, so it's interesting that the politicians are taking, publicly at least, a very backseat position on this. It's the Swedish public health agencies, doctors and scientists, they're the ones who are telling the politicians what to do. And the politicians are saying, if they change their minds, we'll change our minds too, in a heartbeat. But what they're not doing at the moment is changing their minds. Now, as you said, I've spoken to the main guy there, Andres Tegnell. He's the state epidemiologist. He's the sort of Chris Whitty of Sweden, if you like. And I put to him that point that Cecilia just made, that Sweden was in a boat with the UK, both outliers, until Britain left, and Sweden decided to stay the course. Why did they do that?
I think one of the main reasons is that we didn't experience the same rapid increase in number of cases and deaths that you did. And that's why we managed to keep on this a little bit more low-key interventions.
What some people say is that those countries that have taken more drastic measures earlier have shown better results. Are you not worried you may be leaving it too late?
I don't know, and I don't know how true that is. It depends on what measures you're taking and on what timeline you're taking. I mean, we are following very much the same path as Denmark. Denmark has taken much more drastic measures than we have. This is quite difficult right now because I think many countries are in different stages in this pandemic that we're all experiencing. And I think it's a little bit dangerous to look too much to exactly what's happening now. You need to see it in a bit more long term.
How confident are you that you've got this right?
I don't think any can be seriously confident about getting this right, since this has never happened before. And neither the drastic measures that you're taking in UK and many other countries, nor the little bit more lenient measures that we have taken in Sweden has ever been tried before.
What would be the disadvantage of a more wide-ranging lockdown?
Oh, I mean, the consequences would be much, much more dramatic. I mean, we know, for example, if we close down the schools in Sweden, we lose like 20-25% of the workforce. And especially in the healthcare sector. And in the healthcare sector in Sweden, we cannot afford to lose 25% of our workforce. Then the healthcare will basically stop. The other thing is that we really believe that this kind of measures we are taking here is something we can keep on doing for a long, long time. While we don't see that it's possible to keep schools closed, to keep borders closed for more than a very limited amount of time.
Do you think the British government made a mistake in changing tack?
I don't know. Maybe we will know one day. I'm not quite sure we will ever know, because I think it looks more and more that most countries will go through the same thing, more or less independent of what kind of measures they are taking.
When will you know whether you've made the right decision?
Yeah, I mean, I guess it's the same answer to that. We continuously watch over what's happening in Sweden, and we continue to watch over what's happening in the rest of the world. And we are more than prepared to change into doing more things if there is a reason to that, either that our increase is getting very rapid or that we see that somebody else has done something that works very well that would also work in Sweden.
You must be under incredible pressure. There must be moments of self-doubt.
Yeah, I mean, there's always self-doubt. I'm sure that the British and the Germans and the Italians, everybody has self-doubt because, as I said, nobody has ever done this before. There is no prescription on how to do it. We're all trying to do our best in the situation where we are.